So I am going to talk a little bit about something that Helena already mentioned, but before I want to start giving you a picture of how the health system in Cuba is organized, because the success in Cuba handling COVID-19 has not been just a coincidence. It is based on the infrastructure that Cuba has been building over the years. So, as you know, the resources in Cuba are centralized, and then the government gives the public health ministry the resources, the money that they need to spend at the different levels. So we have 3 levels of organization. So in the third level, we have institutions that are national dependency, like research and medical institutes and very high specialized hospitals. We have a second level of attention of care that are at the level of the different provinces in Cuba, where also you have hospitals, and they are subordinated to the provincial health authorities. And then you have the third levels of care that are organized at the level of the different municipalities in each of the provinces, where also you have hospitals, and there you have also the health communities, the health area, and the community. Under this level, you have polyclinics. And these polyclinics, they offer ambulatory assistance to everybody, to the population. So they are organized geographically in the different geographic areas. And under them, you have the family medicine. And also in the first level of attention, you have other municipal units that I'm going to talk about later. So here, under the first levels of attention, of care, they are paying attention to residents according to the geographic area. And here, at the level of and also at the level of the province, and in the third level of attention, they take care of everybody according to the needs. So this is the organization of our health system. So in general, in Cuba, we have 150 hospitals and 449 polyclinics organized in that way, I already explained. And under them, we have about 11,000 family doctors' offices. At the level of the municipality, then we have other units, like maternal homes, where they take care of pregnant women that they present some type of risk. We have elderly homes and grandparent houses. See, these grandparent houses are social places where they, besides socialize, they also enroll in rehabilitation and exercises programs. We have psychopedagogic medical centers, blood banks, and then about between 12, this is a statistic 2019, so we have 12 medical and research institutes that they are specialized in the different medical specialties. So in that way, we have the Neurology and Neurosurgery Institute, we have the Endocrinology Institute, this one that I am showing here, that is Cardiology and Cardiovascular Surgery Institute, and so on. And in this institute, they pay medical attention to people, but also they carry out research. As Helen said, the Cuban health system is universal and free, and also provide a full coverage, and he is focused more on prevention than in cure. Also is regionalized, as I already explained, by geographical areas, and is based primarily, because of that, in the primary health care, in the community practice, and also have an intersectorial approach. The system has a very tight interrelationship with other sectors and organizations, as the biomedical sector and the scientific sector, that allows that everything that is developed here is immediately applied in the Cuban health systems and in the other way around. The different projects and scientific projects that are carried out, they are responding to the needs of the Cuban health system. What we do in Cuba is apply research. We do a very small percentage of basic research, and the basic research is also with the final goal is always to have an exit that could be later applied or translated to a medical or for a solution of a medical problem, or in other type of research to a social problem. And in the middle of all this, you have the community participation, a participation that also is established through what we call mass organization. I don't know whether that is a correct translation in English. This is a people organization where you have the CDR, the women's organization, all of them at the level of the community, at the level of each of the neighborhood. So this system has an influence that today the main causes of death in Cuba are non-transmissible diseases. Like, sorry, this is in Spanish. I didn't have time to do a translation. Like heart diseases, cancer, and cerebrovascular diseases. Those are the first three causes of death in Cuba for more than five years. So, as also you know, probably most of you know, the population in Cuba is a little more than 11 million. For those 11 million people, we have been training and more than 97,000 doctors, of which more than 47,000 has been trained as family doctors. Of them, 26,000 are still working in the community. Why 26 of 47? Because after they are family doctors, they could also, after some year, be trained in another specialty, and they don't work anymore at the level of the community, but they are more specialized. But of those 47, 26,000 are still working in the family medicine practice. And we have more than 84,000 nurses. So these human resources, that is one of the principal, how can I say, this is treasure for Cuba. So Cuba treasure more is the human resources that we have and that we have been training over the years. So we have organized this program that is the family doctor and nurse program that they work, and that is called a basic work unit. This basic work unit is a focus in the three different levels: in the individual, in the family, and in the community, taking into account the environment. And then different programs are implemented. We have a very complete vaccination program that all children in Cuba are vaccinated. That is a reality that is different to other countries, and that is one of the reasons that many infectious diseases, transmissible diseases, has been banned in Cuba. But it's also addressed to the family and to the community. To the community with training program, with outreaching the people. That is another characteristic of this program. It's not only a doctor that is sat all the time in a practice, but it's a doctor that goes to the community to look for the patient. And this system is organized in a way that the population is classified, and every doctor in his community knows how many diabetics, how many hypertensive, how many people with different chronic diseases they have, how many pregnant women. So each of the child in which age group they are, and so on. And they deal with other social problems like attendance to the school, families with social dysfunctionalities, and so on. In general, we have in Cuba more than 11,000 basic work units in which they are working 26,173 family doctors. So besides that, as Helen was mentioning, Cuba has been exercising the international medical assistance or collaboration. So the first medical brigade was sent to Chile after a earthquake in 1960. And in the 1962, Fidel announced in a speech that he was giving to the medical students in the medical school Victoria de Girón, the decision of the government to offer free medical assistance to countries that need it. And in the 1973, the first brigade went to Argelia, and 56 doctors stayed for 14 months there treating patients. So that was the beginning of Cuban medical internationalism. So here I wrote, so for you, if you are interested in the different decades, in how many countries Cuba has been paying, giving medical assistance for free in this, as a, in a way of solidarity and as a medical internationalism. However, in the 90s, so Cuba has to face another context. And was the collapse, as you know, of the socialist bloc and the disintegration of the Soviet Union, with whom Cuba has the main market. So Cuba enters in a special period that was also tightened, but an upsurge of the US blockade to Cuba. That put Cuba in a very difficult situation. And then the international help started to decrease, and a new program started that was the compensated technical assistance and direct contract. And I'm talking about this a little bit because this issue has been a little polemic during the COVID-19 pandemic, with Cuba doing collaboration, and has been used by Trump government to attack Cuba. So I want to explain this a little bit in the way that everybody understands what is going on. So as I was saying, because of this adverse economical situation, is that the compensated technical assistance and direct contract started, where the doctors were paid a little bit of money, and the rest of the money was going to support the collaboration and also the sustain of the Cuban health system. So in 1998, if maybe you don't remember, but I think even United Kingdom was harmed by this. So we have the Hurricane Mitch and the Hurricane George, two very bad hurricanes that in which many people died in Central America, especially in Honduras and Nicaragua, and caused damage over $6 billion. And also we have the Hurricane George, also causing more than almost $14 billion damage that affected mainly the Caribbean island. So given to that situation, the countries in the area started to ask for help, and then Cuba, as in response to that, canceled the debt to Nicaragua that was over $50 million and offered medical and paramedical help, and also Fidel asked to the international community to contribute with equipment and medicine, while Cuba was providing the human resources of the medical assistance. So that was like in different moments during November and December, different medical brigades flew to Guatemala, Honduras, Nicaragua, and Haiti, providing medical assistance for free. So then, with the time, about that time in the 98, 92, with the special period and the disasters in this area because of the hurricane, so was when I started the comprehensive health program that we call in Cuba Programas de Atención Integral, PIS, that started in November 1998. The principle of that program, where we provide free medical assistance to countries, are sending medical professionals, and health technicians for free that are, this help is mainly in the primary care, and this doctor only receive pocket money by the countries where they are going, while they are providing free assistance and attention at the point of care. So they work in rural areas, that are remote, the difficult access, deprived of medical assistance forever. Most of them, they have never seen a doctor. They work, however, under the country law and without intervening in political issues. So the first comprehensive health program was established in Central America and the Caribbean, and later was extended to Africa and the Pacific. And as a support of this, in November 1999, the Latin American School of Medicine was created to make the program more sustainable and able to continue on time. It's in that way that this is a statistic of 2019. Under this comprehensive health program, or PIS, we are providing free assistance to these countries in the Americas, the Sub-Saharan Africa, and the Southeast Asia and the Pacific. And this is free, and this is today. Besides the establishment of this free health medical assistance program has made a big impact in some of the country. For example, this is the child mortality and the maternal mortality in some of these countries. Sorry, again, the slide is in Spanish. For example, you can see here in Gambia how the child mortality dropped, and this is per 10,000 childs. From 121 to 61, and in Ghana for 66 to 10, and so on. And in the case of maternal mortality, again, you can see here the case of Ghana, and even the case of Haiti, with the maternal mortality have decreased in more than, in almost half. So together with this, Cuba has been providing help in natural disasters for many countries for many years. From the 60s, with the first help that I already explained, to Chile because of the earthquake, until the 2000s with the different, with the dengue pandemic also in Central America. And all this medical help, Cuba has sustained for free. So in 2005, then the Hurricane Katrina happens, and Fidel, that always has been the leader and a visionary, proposed to create an international brigade of doctors that could be specialized in disasters and serious epidemics, and they were trained for that in a way that they were already ready at the moment when this natural disaster happened. So in 2006, this brigade was put together, and as a way of offering help to the United States, a help that was not accepted, of course, unfortunately. Today, this brigade, that is the Henry Reef Brigade, that is called International Medical Brigade Henry Reef, is composed by 10,000 members, and more than 4,000 of them has assisted different disasters in Guatemala, Pakistan, Bolivia, Indonesia, Mexico, Peru, and China at different moments. Here you have the statistic of how many collaborators, how many of them has been doctors in each of these countries. But also they has been working during Haiti earthquake in 2010, and during the cholera outbreak that happened the same year, with more than 900 collaborators. So Cuba has been was sustaining the biggest collaboration with Haiti during these two disasters. And of course, all of you know the participation of Cuba during the Ebola epidemic in these three countries, Guinea, Liberia, and Sierra Leone, where Cuba sent 256 volunteers in 2007. So besides that, Cuba sustained a medical cooperation, the medical cooperation that I already said. This medical cooperation, doctors perceive a salary, keep their salary in Cuba while they are working to work abroad. They receive part of his compensation in hard currency, and another percent is received for the country that is used to be reimbursed in the Cuban health systems and in other areas. And I believe and I defend that it is fair, because if some country has the money to pay for the Cuban cooperation to a country that is struggling for surviving, but it's fair to do it. But those countries that doesn't have the money still receive the medical cooperation for free. So today, medical cooperation is covered through this modality, the comprehensive health program that is free, the remunerated technical assistance. We have different programs that I have not mentioned that Cuba has established, that started with Venezuela and then has been expanding to the Caribbean and Africa. But we also offer medical education and training, and then we have the Henry Reef Emergency Medical Contingent or Brigade that also offer free assistance during the disaster. But Cuban medical assistance goes beyond that. Also works in epidemiological control in the country where they go, in sanitary campaigns and vaccination. They train staff. They do consulting, local consulting, but also they offer consulting through the whole World Health Organization and the Pan American Health Organization. And they also do postgraduate and undergraduate teaching. So that was the scenario when we had the first SARS-CoV-2 case in March 2020. A population of 11,000 with this amount of doctors and about 62,000 students in the medical school. At the same time, we have 32 pediatric ICU, 27 medical surgical ICU, 39 general ICU, and 120 municipal ICU, that mainly what they do is to offer emergency care for patients that arrive, and then they transfer patients to a more specialized ICU like this one. So it was good, but not enough for facing a pandemic where you have 11,000 inhabitants. So still, Cuba needed to take other measures to be able to face the pandemic, because even with a very good health system, it was facing the possibility to collapse. It's in that way that Cuba started to apply the experience that Cuba has in epidemiological vigilance with active screening, an active screening that was door to door, reaching people in their houses, and also applying contact tracing. And so a person was suspicious or a patient was diagnosed with COVID-19, and starting from that point, the system was tracing the family doctors, and the team was tracing all possible contacts of that person, and also doing border vigilance. And this program, active screening, contact tracing, and border vigilance, as Helen said, were not new for Cuba. We have dengue. We are paying assistance also in Central American countries where they have faced Zika and chikungunya. We are going to Africa also, where our collaborators are facing other diseases like malaria that is banned in Cuba. So you have also tuberculosis, many other programs. So we needed to keep constant border vigilance and contact tracing. The experience of contact tracing was also very important and developed when the AIDS started, the epidemic of AIDS started in the world, and of course, Cuba was part of that. So also tracing all possible contacts of people that were detected that infected with AIDS. So with that, Cuba also implemented isolation. Isolation that was stratified, was not the same the isolation for people that were contact, that for people that were suspicious, that for travelers. So we have different centers. We also did isolation in houses for people that were suspicious of probably having COVID-19, an isolation in center for travelers. And another thing that was very, very important was daily communication with the population. That daily communication with Dr. Duran, that is the director of epidemiology, he said, and still he does it, every day on TV at 10 o'clock in the morning, informing the Cuban population of all cases. For example, this was today. How many cases were confirmed, who the person is, if it's a citizen, whether it's male or female, how old it is, where in which municipalities it's living, whether have condition that is worsening the perspectives of the diseases or not, and so on, and how many possible contacts that person has. And that is informed to the population for each of the person that is detected every day at 10 o'clock, and it's updated. Also, how many people has been in ICU, how many are critical, how many are seriously ill, how many have died. So there is a daily report on TV. There is also a website that this information is uploaded, but also there is a working group. I don't know whether you can see my pointer. Yeah, okay, great. So this working group where the Prime Minister that is here and the President of Cuba is meeting regularly with all the people in charge of the different areas facing the pandemic, from the Ministry of Health to the science sector and industry, regularly, every week. And also you have programs on TV where the president go with the prime minister, and also the different ministers in the different ministries go to explain the population the new measure and what they are going to do. Cuba needs to reorganize itself completely. And then that was affecting each of the different areas of the country. So there is a government follow-up and a coordination of effort that is done in this working group. This today, this is 30th of July, so it was yesterday, statistics. So still we have 86 people have died. It has not increased for a while. We didn't have anyone critically ill or seriously ill for many days. So today there is one, unfortunately. And this is the amount of confirmed cases until the moment since the pandemic started. So this is one of the strategies that has been active screening and contact tracing. Please, Jacob, if you can run the video.
Es una enfermedad que está azotando a todos los países en el mundo. Nuestro país no es la excepción. El médico de familia en estos momentos juega un papel fundamental. Vive en la comunidad. No esperamos que acudan al médico de familia, sino que vamos activamente a sus casas. Buenos días. Somos del policlínico. A veces hay alguna persona con fiebre, con catarro, con síntomas respiratorios. Todos estos estudiantes están incorporados a las acciones de pesquisa, tratando de llegar a todos los cubanos en el menor tiempo posible para evitar la transmisión de esta enfermedad.
Los mismos médicos que nos dan clases dicen que es una cosa que antes nunca se había visto. Obviamente estoy preocupada, pero bueno, yo elegí ser médico y es lo que me toca.
¿Tienes más miedo o más optimismo?
Optimismo siempre. ¿Qué clase de médicos seríamos si no tuviéramos pesimismo?
Buenos días. Nos sentimos preocupados. No hemos llegado aún al pico máximo de los casos. Estamos trabajando para modificar el curso de la enfermedad, identificando al enfermo y aislándolo y tomando las medidas de prevención con la población sana.
¿Tienes confianza en el sistema de salud de Cuba para poder enfrentar
Plenamente.
esto? ¿Por qué confías tanto?
Porque son los mejores médicos del mundo.
Buenos días, ¿qué edad tienes?
71. Yo soy persona de riesgo, ¿no? Porque yo soy asmática, hipertensa. Siempre, los médicos siempre están chequeando, más ahora. Y le agradezco muchísimo a ustedes.
Nos hace sentir muy orgullosos que nuestra población sientan que las cosas que hacemos pues les son de beneficio. Realmente esa es nuestra razón de ser.
The students were incorporated to this. At the beginning, there was polemic, and then everything that happened in Cuba is about talking to the population and explaining why to the population. A student needed to go there first because they are medical students. They wanted to be doctors, so they should be part of that effort. And also because irrespective of how good the medical doctors are, the success in the pandemic was about identifying early enough the cases for stopping the transmission. And that is why active screening and contact tracing has been capital, essential in the way that Cuba has faced the pandemic. And that has been different to the UK, for example. And another thing that has been different to the UK also is that Cuba asked the patient to stay at home. They were treated at home, and only when they had symptoms, they were going to Cuba asked the patient to go to the health system, to go to the family doctor, not like here, stay at home, don't go until you have a specific symptom. It was just the opposite, because the system was interested in knowing early enough when patients have very early symptoms. So, okay, sorry. Okay, so the program to fight against COVID-19 was structured in this way. So for the healthy people, the system was doing active screening, asymptomatic identification, promoting social distancing. If you know Cubans, you know how hard it is for Cubans to do social distancing. So we are a country where we are used to live very close to each other and talk to each other. So social distancing has been very challenging, and it still is very challenging, and epidemiologic vigilance. For patients with COVID-19 that were confirmed, they were admitted in the hospital or ICU, depending how they were. And then you have protocol for management and treatment, so that were established. Also, protocol for management and treatment were established at the level of the community for healthy people, and I am going to talk about that later. And then for the recovered patients, they continue the epidemiologic vigilance and the follow-up. But also, okay, as Helen said, we stopped transportation. We closed the border, which is very tricky for Cuba, and we work in the awareness of social distancing. The border closure is particularly tricky because, as Helen said, we depend on not only in tourism, but we are an island. Everything comes mainly through the airport, and the other part come through from sea via the sea. So that was very tricky. So Cuba was faced with the need, the Cuban government was faced with the need to start distributing everything that was existing in the country, in the different municipalities, in the different neighborhoods, in the way that was accessible to the population, because all the transportation was stopped. People were not able to move from one municipality, from one neighborhood to another one, except using the bike or walking. So it was very hard. And if you have been in Cuba, you know that you struggle. Still, when you have transportation, you need to move a lot to find the things that you need. So it has been tricky. And the government had to deal with that, with distributing food for people in the different neighborhood and municipality, for people have access to the things that they needed. So things that were usually commercialized in convertibles were then passed to Cuban pesos, and even the Cuban the products that were normally acquired freely in Cuban convertible, then they were regulated, because in the same way that here in the UK you had people that started accumulating because of anxiety, so the same thing happening to Cuba, or even more, because we are lacking product, and then the border was closed. So that has been very tricky, and it still is very tricky for the government, because still the borders are closed. A new measure has been implemented in the last weeks to be able to start recovering from the crisis that the COVID-19 have created. So besides that, phases were established as mandatory, and social distancing is also reinforced by the police, the same way that the face mask is also reinforced for the police, and penalties are imposed to people that don't wear a face mask. Together with this has been several initiatives in the population, because we didn't have face masks. It's not like the Asian country, or we didn't have shops where go to buy this facial mask. And then the community mobilized itself, the civil society in Cuba, to give a response to that need. And then please, Jacob, can you run this small video?
Yo me llamo Evangelina Navalón Ceballos. Yo empecé a hacerlo en Asaúl. Lo empecé a hacer con mis propios medios. Pero es fácil en casa. Coge una tela, la divide en 3 partes iguales. La cose en los extremos, la vira, hace 2 pliegues, cose a los lados y busca una tira larga que le coja toda la cabeza. Le monta la tira aquí en el medio, cose a los lados y ya está el nazaú. Miren cómo queda. Voy ahora por 255 personas. Priorizo a los viejos. No cobro un medio, no quiero nada de dinero. Feliz me siento de hacer esto.
Together with this, I have to say that not only the community mobilized to produce face masks, but also the private sector helped producing face shields using 3D printers that they already have in the different business. So it has been a combination of the state sector, or the governmental sector, and the private sector to fight together the pandemic. So, but besides that, Cuba also have an infrastructure of biomedicine and science that has been fundamental for facing the COVID-19. So the BioCuba Pharma is we call enterprise, but it's a governmental enterprise under which all the scientific centers are organized. All of them producing different type of products that are supporting the health system in Cuba and the pharmaceutical industry. So as early as in 1960, Fidel said in a speech, when Cuba barely have any scientific infrastructure, that Cuba's future must necessarily be a future of people of science. And that was a premonition, because that is one of the biggest infrastructure that Cuba has and has been fundamental for fighting the COVID. So BioCuba Pharma, with all its center, is working in 15 projects for COVID-19. 6 are treatment projects, 6 are related to prevention at risk groups, 2 are diagnostic projects, and 1 is a medical device. 9 are undergoing clinical trial, and 6 are still in research and development phase. There is also other projects that are in early stages, like the unspecific vaccine for boosting natural immunity, and one specific SARS-CoV-2 vaccine that is being developed by the biotechnology center. So when the COVID-19 started, already we have many products that have been developed and approved for human use. So, and what Cuba Pharma and the different centers did was starting to redirect the application of this product to use it in COVID-19. In a way that there is 17 national products that are being used to help patients, and 2 products only are imported. At the community level, so that is the strategy of care, so they are using active screening, and they are using a product that is a national product that is called Prevengovir. And in social institutions, then, for older people, fundamentally, they are using the biomoduling T that is increasing the immunity in people, promoting the response of the T cells in the body. So here is the amount of people, between brackets, that has been treated with this product. At the level of the surveillance center for travelers, they are using also the Prevengovir, that is the natural product, but also the biomoduling for people over 60 years old, and transfer factor that is produced in the biotechnology center for people below 60. This is also for boosting immunity. In the center with COVID-19 suspicious individuals, then they are using antibiotics like azithromycin, and this oseltamivir, that is the name of, that is also commercialized as Tamiflu. So everybody knows this is for influenza flu treatment, and interferon alpha 2V that has been that is produced by Cuba. And then for patients with COVID-19, they are using this retroviral that is imported, that is Caletra. Besides the chloroquine and interferon, both produced by Cuba, and in critical ill, then they use other products also produced by Cuba, like the erythropoietin. This peptide that has been proven very good at boosting the immunity, and has been this has been a clinical trial with very favorable results in critical ill patients. That is CIV, that is Biotechnology Center 258. So all these products, most of them, the 17 of them are national products again, and imported, like the Caletra and the oseltamivir. Besides that, we have the Immunisate Center. The Immunisate Center already has a very long expertise developing kits for many diseases, in the way that, besides using the standard way of detecting or diagnosing COVID-19 with rapid tests and antibody tests, Cuba developed a rapid diagnostic kit for testing the immunity of population, so the amount of antibody, the immunoglobulin G that the population has, that is giving you the level of immunity for exposition that the population already has. So that was developed in very little time by this center, again, not by a coincidence, but because it has a long tradition producing other type of kits. So then there is the Cuban Neuroscience Center with a long tradition producing medical devices that is going to have ready for October 2020 100 ventilators for patients, 250 invasives, 250 not invasives. And the problem was that the ventilators that normally Cuba didn't have enough ventilators. It was not able to acquire ventilators in the market, but because the companies that normally used to sell those ventilators to Cuba, they were bought by the US company, and the blockade forbid this company to provide Cuba with new equipment or with spare parts. So Cuba has to find a solution, and that was the task given to the Cuban Neuroscience Center that is also part of the BioCuba Pharma. So then, again, this way of organizing the system was you have the human resources and an educational system providing the students. You have the technology and the industry. You have already products that are intellectual property, and you have a national health system. The integration of all that what was put Cuba in a position to face COVID-19. So this is how Cuba is in the last month. That is in July. In red, you have the number of deaths that you can see has stayed the same for many days now. So in 86. So you have the number of cases that is still increasing, a very slow rate of increment. In the last weeks has increased a little more because Havana and other provinces has passed from phase 1 to phase 2, where transportation is possible and people are moving more. So now there is a call to people for have awareness about social distancing, keeping the measure for not putting in danger the response that Cuba had so far. And you can see here the number of recovery. In general, the progression of cases in Cuba has been very, very slow. And then you have the international cooperation. Cuba then started to send brigades for free to different countries. It started with Italy, and from that point, more countries were asking for help. So now we have 59 countries, over 28,000 collaborators helping these countries fighting COVID-19.
This business of forced labor is the functional equivalent of slavery.
Esclavo yo que recibo de mi país todos mis estudios gratis. Esclavo yo que mi familia recibe mi salario completo estando fuera. Esclavo nosotros, esa es la teoría de ellos.
Nosotros lo hacemos voluntariamente. Nadie a mí me obliga a ir a ese país. Cuando otros países del mundo nos tildan como esclavos, pero a nosotros eso no nos importa. Lo de nosotros es contribuir con el mundo, contribuir con la humanidad.
Porque hay otros pueblos que me necesitan. No deben de morir las personas cuando hay profesionales y personas que estamos capacitadas.
Voy porque soy médico. En definitiva, para eso se deben formar los médicos en el mundo, para curar personas. No importa si es en Cuba o en cualquier latito del mundo.
Eso forma parte del genoma humano de los cubanos y simplemente ayudar al que lo necesite. Yo sé, no era nada más justo que nosotros pudiéramos ayudar a otros países.
So then there is the acknowledgement of the population about the work of Cuban doctors and how the system in general is not only the Cuban doctor, it's how the whole system and the whole country, because it has been a joint effort. It's not fair to say it has been only the doctors. The response of the doctor has been excellent, but all the prevention, the tracing, the response of the biomedical sector, the response of the scientific institution has been basic for the success of Cuba in this pandemic. And I want to close with this video. I'm sorry for extending so much.
Agradecemos a los médicos porque precisamente nuestros médicos son esforzados, no escatiman tiempo para salvarle la vida a las personas.
Aplausos por su gran trabajo, por su esfuerzo. Es muy grande lo que ellos hacen.
La alegría es la mejor medicina que hay para el ser humano.
Cubanos siempre estamos seguros de nuestros médicos. No tienen ni los medios necesarios, pero salvan las vidas y están ahí. Muy orgullosa de mis médicos, porque es que son lo mejor del mundo.
100% confianza y seguridad de la medicina cubana, porque el país ha hecho todo y ha gastado todo para que nuestro pueblo se sienta seguro y se sienta fuerte y podamos combatir esta epidemia tan grande.
Great, thank you, Valia. That was a really useful introduction, well, a really useful speech. The slides were really fantastic. We will be making the video public on our Rock Around the Blockade website.